John here from Anatomy Bootcamp, and welcome into another video. In today's lesson, we're going to be taking a look at the cerebral vasculature, specifically all these structures which work together to provide blood supply to the brain. Starting off first, of course, we have our case. In this case, we have a 65-year-old patient with a history of hypertension and hyperlipidemia, and she presents to your ER complaining of sudden onset of weakness in her right side of her face and upper body. After examination, you conclude that she's also experienced dysarthria, global aphasia, right side facial droop, and right side hemiplegia. You then order an angiogram with contrast, and this is what you find. So what we want to answer is, which vessel is likely involved right here, and what areas are this blood vessel supplying? So first, just a quick overview of how we get the blood vessels into the cranial cavity. Of course, you remember from head and neck, we have two pathways. One's going to be anterior, going through that carotid canal, and the other is going to be posterior, going through the foramen magnum. So first up, we have our common carotid. It divides into the external and the internal. The internal one is going to be the one which enters that inferior aspect of the base of skull and enters into our cranial cavity. The internal carotid is going to be responsible for supplying about 80% of the blood to the brain. The other 20%, well, this is going to come from this artery right here. This is that vertebral artery. If you remember, it passes through these foramen transversarium on those cervical vertebrae and comes up towards the base of the skull where we have that foramen magnum, where it will then enter and course along the anterior aspect of the brainstem. So let's start off by following those vertebral arteries up. So here are two vertebral arteries on either side. They're going to come up, and as they do so, they're going to give off a number of branches. The first branch being these branches right here, and this branch right here. So these two branches on our outside, those are going to be our posterior spinal arteries, and this branch right here is going to be our anterior spinal artery. And like the name would suggest, they're going to supply the posterior and the anterior aspects of the spinal cord as it descends down. We also have these branches right here. And right before, or right as, those two vertebral arteries merge to form this artery, they give off these two branches. So these branches down here, well, these are going to be our posterior inferior cerebellar arteries. And these arteries up here are going to be our anterior inferior cerebellar arteries. And you can tell by the name what area of the cerebellum they're going to be supplying. So the anterior inferior is going to be supplying the anterior aspect of the cerebellum, and that posterior inferior is going to be supplying that posterior aspect of the cerebellum. So just to recap, we're going to have those vertebral arteries coming up. We're going to have the posterior spinal and the anterior spinal coming off directly, as well as that posterior inferior, which is going to be superior to the posterior spinal. And then up here at the beginning of this artery right here, which is our basilar artery, this is where we're going to have the anterior inferior cerebellar artery. So like I just mentioned, those two vertebral arteries are going to come up and form this big thick artery. This is going to be that basilar artery, which rides along the anterior aspect of the pons, and it gives off these little arteries right here. And these are known as pontine arteries because they come off and they supply the pons. So we have the basilar artery and the pontine arteries. Now at the very top of the basilar artery, we're going to have two arteries coming off on either side. One's going to be right here, and then there's going to be another one just superior to it. And this occurs on either side. So these ones right here, which are going to be inferior, these are actually the superior cerebellar arteries. And if you remember down here, we have the anterior inferior cerebellar artery and the posterior inferior cerebellar artery. So this is that superior cerebellar artery, and there's no anterior or posterior, there's just the one. And then above that, these are where we're going to have those posterior cerebral arteries. And coming off the posterior cerebral arteries, we have the posterior communicating arteries. And as we move up, these posterior communicating arteries, well, these are going to join with these arteries right here. If you remember, these are those middle cerebral arteries, which arise from those internal carotid arteries. So this internal carotid artery comes up, gives rise to that middle cerebral artery, as well as this artery right here, which is the anterior cerebral artery. So we have the internal carotid artery, the middle cerebral artery, and the anterior cerebral artery. So now we're almost done. We just have a couple of small branches coming off. The first being this one coming off of that middle cerebral artery. These are going to be the anterior choroidal artery. If you remember from the ventricular lesson, these actually supply the choroid plexus among other things, but these are responsible for bringing blood to those choroid plexus to produce that cerebral spinal fluid. And then also we have this artery right here coming off of the internal carotid artery, and this is going to be that ophthalmic artery which travels with the optic nerve to go supply the eyeball with blood. Up here we're going to have the communicating artery connecting our two anterior cerebral arteries, and then coming off just right here, so we're going to have our medial striate arteries. So let's get these labeled. So one last time, we have our posterior spinal and our anterior spinal. Just superior to that posterior spinal, that's where we're going to have that posterior inferior cerebellar. And then superior to that, just at the top of our vertebral arteries, where base of our basilar artery is formed, that's where we're going to have those anterior inferior cerebellar arteries. And of course we have that basilar artery with all these little pontine arteries coming off. We're going to have our superior cerebellar arteries right here, as well as our posterior cerebral arteries up here. Now connecting the posterior cerebral to the middle cerebral, well, this is where we're going to have that posterior communicating, and here's that middle cerebral on either side, which originates from that internal carotid. Coming off that internal carotid, we also have the anterior cerebral. And then we have all these little branches, which are going to be our anterior choroidal, our ophthalmic, our anterior communicating, connecting the two anterior cerebrals, as well as our medial striate arteries. And of course, we have our anterior cerebrals and our anterior communicating artery, along with those posterior communicating arteries and our posterior cerebral arteries, which make up a circle. And this circle is known as the Circle of Willis, and this allows for continuous collateral blood flow throughout the brain's cerebral vasculature system. So now let's take a look at what these arteries look like on an angiogram. So first up, I'll just point some things out that we can use. Right here, this, and this, that creates our Circle of Willis. Just to orient us a little bit, back here, we have that big, thick artery, which is made by two ascending arteries. It's going to come up, it's going to give off these arteries, which are going to join to form this Circle of Willis. We're then going to have arteries coming off on either side and going anterior. So let's label these. The first one is going to be our anterior cerebral artery. Well, that is going to be coming off right here. And if we orient ourselves, again, here's that Circle of Willis. These are the internal carotids coming up. So if this is anterior, then that makes these ones the middle cerebral arteries. So these middle cerebral arteries come off, and then they form like these giant spiderweb-like networks. And found between those two anterior cerebrals, this is where we're going to have our anterior communicating. Then we're going to have those posterior communicating between our posterior cerebrals and our anterior cerebrals right here. So then following those posterior communicating back here, coming off on either side, well, these are going to be those posterior cerebrals. Moving downward, we're going to have this basilar artery right here. And then forming that basilar artery on either side, we're going to have our vertebral arteries. And if you think about it, it kind of looks like a stick man with a massive head wearing some sort of crown. We're going to have our two legs, which are going to be our vertebral arteries, our body, which is going to be that basilar artery. We're going to have our arms coming off. These are going to be our posterior cerebral arteries. And we're going to have this massive head. This is going to be the posterior communicating as well with the anterior communicating. And we're going to have our crown, which is going to be our anterior cerebrals as well as our middle cerebrals. So whenever you're looking at an angiogram like this, always look for your stick figure. You can see here we have those legs, which is the vertebral arteries, our body, basilar artery, our arms right here, which are going to be our posterior cerebrals. Then we have these posterior communicating along with the anterior communicating, which is going to form the head. And then our crown, or our weird hat, whatever it is, it's going to be formed by our anterior cerebrals coming off as well as our middle cerebrals going laterally. And then you can see in the angiogram, we kind of have like these horn-like tusks coming off. These are going to be those internal carotid arteries. So now that we've identified all of our vessels, let's look at the areas of the cerebral cortex which they supply, and it's actually pretty intuitive how the blood is distributed. So if you think about it, our anterior cerebral arteries, well, those are going to come up, and then they're going to wrap back around. So think about it. In here is that circle of Willis. The anterior cerebrals come off, go anterior, and then go superior. The middle cerebrals are going to come laterally, and the posterior cerebrals are also going to come laterally. So this thin strip along the medial aspect of the cerebral cortex, this is going to be supplied by the anterior cerebral artery. Anterior cerebral artery comes up and then wraps around. This red area right here, spanning the lateral cortex, spanning the frontal, parietal, and temporal lobe regions, this lateral cortex, this is going to be supplied by that middle cerebral artery, which makes sense if you think about how it comes off. It comes laterally off of that circle of Willis. And then finally, we have back here doing the medial aspect of that posterior cerebral cortex, as well as the inferior border of the temporal lobe. This is going to be that posterior cerebral artery. And if we look at a midline section, you can see that anterior cerebral artery is going to be responsible for supplying the majority of the midline structure. So if you think about it, that anterior cerebral artery actually comes off right here, and it travels through this sulcus. It's going to give off another branch right here as well. So it comes anterior, and then it wraps around and goes superior and posterior. And similarly, we have that posterior cerebral artery coming off right around here. It's going to come off and it's going to come under and do the occipital lobe region as well as that inferior border of the temporal lobe. So then how does this look like on our homunculus? Well, if you think about which structures are along the medial aspect of the cerebral cortex, so along that median longitudinal fissure, it's going to come up to about right here. So looking at both our sensory and our motor homunculus, it's going to be providing blood supply to the part of the primary motor and the primary sensory cortex, which is involved in the trunk and lower limb regions. And then if we look at the middle cerebral artery and the area that covers, it's quite large. So that middle cerebral artery is going to be covering the remainder of those cortical areas, spanning from the upper limb to the face to the muscles which control speech production. And you can see just on this diagram how much of each region is covered by each blood vessel. So for example, if we had a rupture in the anterior cerebral artery in the motor homunculus affecting this region, we would have weakness or paralysis in the lower limb as well as some of that torso structure. And likewise, if we had a rupture and occlusion in the middle cerebral artery, just how many structures would be affected in that case. Now let's take a look at the vascular territories on the cerebellum. Starting off first, we have that superior cerebellar artery. And like the name would suggest, it's going to come over here on that superior aspect where that anterior lobe of the cerebellum is, and it's going to provide all of this region with blood supply. We then have that anterior inferior cerebellar artery, which is going to be supplying where the name suggests. So it's going to be the anterior aspect, and it's going to be inferior to our superior cerebellar artery. So it's going to be providing a lot of this internal region right here. And then lastly, we have our posterior inferior cerebellar artery, and this is going to be providing this posterior aspect as well as a lot of this inferior aspect in relation to the other two blood vessels. And coming to this diagram, you can see this superior cerebellar, it's going to come off, it's going to give off these branches. This anterior inferior is going to come off and do the anterior inferior aspect, and then we have our posterior inferior, which is going to come off and do the posterior aspect of the cerebellum. So now coming back to our 65-year-old female patient who's complaining of a sudden onset of weakness on the right side of her face and upper body, as well as dysarthria, global aphasia, right-sided facial droop, and right-sided hemiplegia. So dysarthria, that's difficulty with motor speech production. Global aphasia, that is both receptive and expressive language comprehension deficits. So she's unable to comprehend what is being said or what is being asked for. And this also plays in with auditory comprehension as well as visual comprehension and right-sided facial droop. So this is loss of muscle tone on the right side of her face, and right-sided hemiplegia. So this is just paralysis basically on the right side of her body, which is affecting both sensory and motor. So what can explain this? Well, if you think about it, the right side of our body is controlled by the left side of our brain, and our language processing centers are also controlled on the left side of our brain. So in this case, which blood vessel supplies the lateral aspect of the cerebral cortex that would involve both our language centers as well as our facial and upper limb sensory and motor areas? So if it's on the right side of our body, it must be on the left side, and the language areas are also on the left side. So it's going to be our left middle cerebral artery. And if you look at our angiogram right here, here's our stick person. So we got our legs, our body, our arms. Here's our head and our weird crown. Coming off right here, this is that middle cerebral artery. Coming off right here, this is that middle cerebral artery. You can see we have an occlusion right here. So the dye is being blocked from passing through. And this means that not enough blood flow is going to the left cerebral cortex, which is where our language centers as well as our motor and sensory for the right side of our body is found. So looking at the areas which the middle cerebral artery supplies, well, it's going to be both our primary motor and our primary sensory on the left side, which is going to explain the right-sided hemiplegia. It's also going to be involving Wernicke's area as well as our auditory cortex, which is explaining the global aphasia. And then it's also including Broca's area, which is causing those motor speech deficits. So when you get a whole list of symptoms, you need to think about how they relate to each other, what do they have in common, and what can be explaining this. So moving on from our case study, we have a couple of practice problems. We have what blood vessel supplies area A, and then what blood vessel supplies area B. So area A is going to be this area right here. Area B is going to be this area back here. If you want, pause it, answer it. I'm just going to solve it right now myself. So area A looks like it's pointing to this anterior and medial aspect of the cerebral cortex. And if you remember which artery supplies this area, well, that's going to be that anterior cerebral artery. And then we also have this area back here for area B. And considering that it's posterior, what artery do you think is going to be supplying that area? Well, it's going to be that posterior cerebral artery. So again, anterior cerebral artery supplies that anterior medial area. Posterior cerebral artery supplies this posterior medial as well as this inferior temporal area. And then that middle cerebral artery is going to supply that remainder. Next question, looking at an angiogram, identify structure A, identify structure B. So I'm going to solve them. So the first thing that we want to do, find our stick man. We got our legs right here, our body, got some arms coming off, got our big head with our weird crown. So here is our Circle of Willis. And then what arteries do we know that makes up our Circle of Willis? These are going to be those posterior cerebral. We're going to have posterior communicating in there somewhere, as well as our anterior cerebral and our anterior communicating. So A, found between our two anterior cerebrals. Well, this right here, that's going to be that anterior communicating artery. And then B, coming off of our body, forming our arms, this is going to be that posterior cerebral artery. So again, quick overview: vertebral arteries, basilar artery, posterior cerebral arteries, anterior cerebral arteries, anterior communicating, and our middle cerebral. And we also have those internal carotids coming up. So when you're all studying for this, you should be able to name and identify all the blood vessels which make up the cerebral vasculature, describe the blood supply of the cerebral cortex, as well as the cerebellum, and then describe the location of vascular damage based on a functional deficit, similar to like we saw in our case study. So with that said, I want to thank you all for tuning into this series. I hope you had as much fun as I did, and I want to wish you the best of luck studying for your anatomy exams in the future.